Millions of people are being given powerful antibiotics to treat common infections.
Now, as Erin Kennedy reports in Health Watch, some safety advocates are warning that these antibiotics are dangerous. They want the FDA to do something about it.
I was a very healthy person at the time. I bicycled about 7 to 10 miles a day. I could bench press 300 pounds.
Now, just helping his wife prepare a meal can be almost unbearable.
I have days that I can't lift a half a gallon of milk. And if I do, I have to go lay down and rest for a while.
54-year-old David Melvin suffers from chronic fatigue, neuropathy, and digestion problems, all due, he believes, to the antibiotic Levaquin given to him for a common infection 8 years ago.
I don't know what the future holds, whether I've got 5 years or whether I've got 15 years.
Levaquin is in a class of drugs called fluoroquinolones. These drugs already carry a black box warning for tendon ruptures, muscle weakness, and central nervous system damage.
It is powerful.
Dr. Charles Bennett is one of the nation's leading watchdogs for prescription drugs. He says the big problem with fluoroquinolones is inappropriate use.
And we're talking about going to a physician's office, having a little bit of sniffle, walking out with an antibiotic, and then shortly thereafter, having these kind of problems.
Bennett has filed 2 citizens' petitions with the FDA. One seeks to expand the black box warning to include mitochondrial toxicity, meaning damage that can occur within a patient's cells and possibly show up years later as Parkinson's, Alzheimer's, or ALS in patients who may be more at risk.
Potentially a genetic predisposition to be a poor metabolizer of the drug. So it's not what you take it for, it's who you are.
The second petition wants to highlight the potential for serious psychiatric events.
This is another one if I'm depressed.
Caroline Egan took Levaquin 8 years ago for a sinus infection and hasn't been the same since.
One day I can be okay on focus, and another day I can't even talk to anybody because they're not making sense.
Melvin had to retire early from the Illinois State Police and now focuses on his blog dedicated to the Levaquin safety issue. Through emails, people tell him the pain is almost unbearable. I woke up one day in hell. So what does he want to see happen to these drugs?
I don't think they need to be taken off the market, but I think doctors and patients need to be informed.
Erin Kennedy, CBS 2 News.
Janssen Pharmaceuticals, the maker of Levaquin, gave us this statement, which reads, in part, at Janssen, our first priority is the well-being of the people who use our medicines. We are aware of the citizen petitions, and we are evaluating them. To read Janssen's full statement and to learn more about fluoroquinolones, log on to our website, cbschicago.com.